So gozalkimab is a new class of biologic therapy targeting the immune system and targeting what's known as a cytokine, a key cytokine in the pathogenesis of psoriasis, interleukin-23. So this is a new class of biologic therapy, and gozalkimab is probably the one that's most advanced in its development. So gozalkimab differs from currently available biologic therapies in that it targets interleukin-23. And interleukin-23 is high up in the cascade of cytokines which are important in the development of psoriasis. So by switching that off at source, you then switch off all those cytokines below that which are cascading down, particularly interleukin-17. The current or new kids on the block are the biologics which target interleukin-17. This is targeting interleukin-23. So it's a new form of biologic therapy. The method of administration of gozalkimab is similar to other currently available biologics. It's self-administered subcutaneous injection at the beginning of treatment, then after 4 weeks, and then every 8 weeks for long term. So the Voyage 1 study, and you can tell by the fact it's Voyage 1, there's Voyage 2 and 3 as well, is a trial comparing gozalkimab with placebo against currently the market leader biologic therapy, an anti-TNF-alpha biologic called adalimumab. And the primary endpoint was at 16 weeks, but then working out beyond that to 24 weeks and 48 weeks. So it's both a short-term and a long-term study. So the results which are being presented here in Vienna as part of the 25th Congress of the EADV are very exciting. These are previously unknown levels of response for a biologic therapy in psoriasis. So one way we assess psoriasis is something called the PASI 75. So that's a 75% improvement in the clinical severity of psoriasis. And at 16 weeks, 24 weeks, and at 48 weeks, more than 80% of patients randomized to gozalkimab achieved this PASI 75. So that's not both a short-term response and also a durable long-term response. But even more impressively is that we're now not looking at just 75% improvement, but we're looking at something called the PASI 90. That's a 90% improvement. And we're seeing with gozalkimab very high levels of PASI 90 improvement, both at 16, 24, and 48. Yeah, so with placebo, we saw only about 5 to 6% of patients achieving PASI 75, PASI 90, and adalimumab was lower levels, about 75% of patients achieving PASI 75, and fewer numbers achieving PASI 90. So there was a significant difference at all stages of the study, 16 weeks, 24 weeks, and 48 weeks between gozalkimab and adalimumab. And both of those were significantly better than placebo by some way. So measuring the severity of psoriasis is not just what it looks like on the skin, it's how it affects the patient's daily life. And that's something called the DLQI, the Dermatology Life Quality Index. And that's a very commonly used measure of psychosocial disability in patients with psoriasis. So a DLQI of 0 or 1 indicates that there's no effect on the individual's quality of life. It's a normal quality of life. And what we found with gozalkimab was that more than 60% of patients achieved a DLQI of 0 or 1 at 16 weeks, 24 weeks, and 48 weeks. So the majority of patients on gozalkimab had a normal quality of life, which is tremendous. So not only was the psoriasis significantly improved by 90%, but the patients, for the most part, felt that they could just lead a normal life. Yeah, so there's ongoing studies which will be presented at further international congresses in dermatology, published in peer-reviewed scientific journals, looking at the longer-term response, because psoriasis is not a short-term disease, it's long-term, lifelong. So if you can demonstrate this sort of level of efficacy not just a year, but 2 years and 3 years, then that is very significant change in patient circumstances. Well, the data from the early voyage studies has already been submitted to a scientific journal for publication. We'll wait and see the outcome of that. And then the data as it comes forward from the trials will be presented at future international dermatology meetings, and most likely at the American Academy of Dermatology meeting in March next year, which will be held in Orlando, Florida. So, if I had been standing here 11 years ago, I'd have been talking with some excitement about improving psoriasis with biologic therapies used at that time by 75%. That's moving from what we previously had, which was 50%. Now we can realistically attain PASI 90% improvement in the vast majority of the patients treated with guselkumab. This is a game changer for patients with severe psoriasis. So there's going to be minimal disease left. In some cases, they had no disease left, PASI 100. So if you match that with the psychological outcomes, these patients are being returned to a normal life, probably for the first time since they developed psoriasis. Now, this is very exciting for patients because we could never legitimately promise patients, majority of patients, that they're going to get almost complete clearance or clearance. Now we can do that. It's not going to be every patient, and we still don't have the ability to say or to identify which patients are going to get this very high response, but the majority are. So that's important. It's also very important that this is a durable response. It's not just 16 weeks and then it's going back to what it was before. This is long-term clearance, and that's what patients want. They want to have the comfort of knowing that once they clear with this drug, it's going to stay clear. Because one of the things we've noticed over the years is that patients have been there before. They've been on other treatments and then the disease starts to relapse. So there's always that background concern or worry that the disease is going to start to come back. We have not seen that out at 48 weeks, and I think it's likely this is going to continue over the long term.